All right, welcome back. Hope you're all having a great week as we move towards the 4th of July. Hope you all have a happy and safe holiday. Today, we're continuing our practice question series where we're going through a set of practice questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our proven study materials, please check out RBT Exam Review.com. We offer 3 practice exams, a task list study guide, and the combo pack, which comes with everything. Congratulations to all the RBTs who recently passed their exam. When you pass, let us know so we can include you in our Sunday shout out. Other than that, let's keep working hard, keep studying hard, and get to our questions. Question 1. Tom slaps Greg while the teacher is not looking. In response, the teacher sends Tom outside the classroom to sit in the hall. 30 minutes later, Tom comes back into the room and slaps Greg again. The teacher sending Tom outside serves as what? Okay, punishment reinforcement question. What do we ask ourselves when we get a punishment or a reinforcement question? We ask ourselves, is the behavior increasing or is the behavior decreasing? Once we determine that, then we have to figure out, is it positive or negative by asking ourselves, are we adding something to it or are we taking something away? So in this case, what is the teacher doing? Well, in response to Tom slapping Greg, the consequence is going to be the teacher sends Tom outside the classroom. So she's removing Tom from the classroom, making it negative. However, 30 minutes later, Tom comes back into the room and slaps Greg again. So has Tom's behavior increased or decreased as a result of being removed from the class? Well, his behavior has at least maintained, if not increased. And when that behavior maintains or increases, we call it reinforcement. So the teacher removes Tom, negative. Tom's behavior maintains or increases, reinforcement. The teacher sending Tom outside serves as a negative reinforcer. You're listening to music with your client. You say, my money don't jiggle jiggle, and your client says, my money don't jiggle jiggle. Your client's behavior is an example of what? Okay, pretty easy question here, but we're going to use it as kind of a learning opportunity, right? So if you say something and your client says it exactly back to you, or you do something and your client copies you, what do we call that? Well, we call it a imitation, right? Think about any imitation in life. If you imitate somebody, what are you doing? You're copying them. Imitation is a very important skill for learning. Okay, we teach imitation in a lot of different ways. In this case, this could also be known as an echoic if we're talking verbally. But if your client is copying what you're doing, it's imitation. Now, to qualify for imitation, the copying has to occur immediately. Okay, so we don't consider it imitation if you say this phrase and then 3 hours later, your client says that phrase. Okay, it's not imitation in an ABA sense. Regardless, the client is copying you, it's imitation. Now, you are considered the model. So when you say this, you are actually modeling for the client. It would be the same way as if I'm trying to teach my client a dance move and I model the dance move for my client. Modeling is also a type of prompting. An intraverbal is a type of verbal behavior where we're having a conversation. This is not a conversation. They're repeating exactly what you're saying, not an intraverbal. And a mand is a request. So a mand is when someone makes a request, makes a command. Can I have some water? Can you leave me alone? Etc. So again, your client copying you, your client is imitating your behavior. You were the model. Okay. Make sure you understand that distinction. You imitate the model. And in most cases, the RBT, you're going to be modeling, your client will be imitating. As practitioners of behavior analysis, what should we ask ourselves when deciding how to act ethically towards our clients and stakeholders? All right. I like to throw this ethical question in every now and then because when the BACB board begins their ethical code, they always try to lead with these questions, okay? Because these are our guiding principles, right? We have all these ethical standards that we have to know, we have to live by. But at the end of the day, what do we ask ourselves when deciding how to act ethically towards clients and stakeholders? A, what is the right thing to do? Should we consider what the right thing to do is? Absolutely. You may be put in difficult situations as an RBT, especially with some of the populations that we use ABA with. You always need to ask yourself, what is the right thing to do? Okay, what is it? What is the right thing to do billing wise? What is the right thing to do treatment wise? If I don't agree with my supervisor and I think it's unethical, what is the right thing to do in that situation? How about what is worth doing? Okay, this is important because we have limited time with our clients. We need to determine what is worth our time, what isn't. And then C, what does it mean to be a good behavior analytic practitioner? So at the end of the day, what does it mean to you to be a good technician? So as practitioners of behavior analysis, we ask ourselves all three: what is the right thing to do? What is worth doing? And what does it mean to be a good behavior analytic practitioner when we're trying to decide how to act ethically towards our clients and stakeholders? Our answer is D, all the above. Which of the following answer choices describes the behavior functionally and topographically? Okay. When we are defining behaviors, we need to know what? Well, we need to know what they look like. More importantly, though, we need to know why they're occurring. And the why they're occurring is considered the functionality. Okay. So topographically, we're describing how it looks. It's not just enough to say the client was aggressive or the client engaged in behavior or the client eloped or whatever. We need to describe as much as possible what that looked like. That's the topography. And then we need to say, okay, why did it happen? What are our four functions? Tangible, attention, escape, automatic. Which one of those four are the most likely reason the behavior occurred? And as the RBT, you're going to be hypothesizing functions as behaviors arise. Our answer or our question wants us to describe behaviors both functionally and topographically, meaning we're looking for the answer choice that describes not only what the behavior looks like, but also why that behavior occurred. A, Ty will throw a tantrum when his mom asks him to come downstairs to avoid doing his chores. Well, immediately we see a function, avoidance. Great, right? However, Ty will throw a tantrum. Are we describing this topographically? No. Tantrum means a million different things to a million different people. This is not describing what it looks like. Okay, you're just labeling it. We need a description. What does that tantrum look like? We have the function part. We're missing the topographical part. B, Greg will grab a crayon, place the tip on the wall, and draw letters and shapes. Okay, now we have the topographical part, right? We are describing exactly what the behavior looks like. I can go in there and be able to see what you are describing to me. Anybody could. Crayon grab, place tip on wall, draw letters and shapes. However, why is it occurring? We're missing the function. C, Jay will put his feet together and move them in a back and forth motion in order to gain attention from his mom. All right, this is much better. We obviously have the function, right? Gain attention from his mom, but we also have a much better topographical description. You can tell what we're trying to look at here. Put feet together, move them back and forth motion. We can all see that, right? Now you can expand even further and add quickly, slowly. Sure, right? We can always get deeper topographically, but putting feet together, moving them back and forth motion is a better topographical description than just tantrum. And then D, Melissa flaps her hands. Doesn't really tell us much at all. D is not a good way to describe behavior. The best way to describe behavior out of all the answer choices is C. Jay puts his feet together, moves them back and forth in a back and forth motion in order to gain attention function from his mom. The plan or rule that dictates or tells you when to deliver reinforcement is considered the what? Okay, we've done this question before, but I had a few follow-ups about it, so I figured we'd run it again, right? We're all about repetition, okay? We want to be fluent. You don't gain fluency by just doing it once. You got to do it over and over again. So when we have a plan or rule that tells you when to deliver reinforcement, what is that considered? Is that an antecedent schedule? Well, we don't really have an antecedent schedule, right? Nor do we have a response schedule, but we do have a reinforcement schedule. The reinforcement schedule is going to tell you when to deliver reinforcement. If I have an FR3 schedule, I know every 3 responses I'm reinforcing. If I have a VI 5-minute schedule, I know on average I'm delivering reinforcement every 5 minutes. Without that reinforcement schedule, okay, we are not delivering reinforcement with a plan. That's an issue. We always want to be doing everything with a plan, right? We don't do things just because. So when we develop reinforcement schedules, it's a plan or rule that dictates or tells you when to actually deliver the reinforcement. Okay, we need to follow these reinforcement schedules. If you believe they're not working or they should be different, we need to address it with who? Our supervisor. Clarissa is chatting with her client's mom while her client eats lunch during session. Her client's mom mentions that the client's skin dries out in the summer due to heat and a lack of moisture. The RBT tells the mom that she knows this great lotion that can help the client's dry skin. Did the RBT do anything wrong? All right, last week we talked a lot about rapport building, and the RBT, Clarissa, is by all accounts attempting to do just that. She's doing a great job of making small talk, engaging with the parents. We are not invisible in the household, right? We are part of the household. That's just something we need to accept. It's okay to talk with the parents, right? However, the problem becomes when she starts recommending things like lotions. Now, lotions can cause all kinds of reactions. We don't know what the lotion is. We're not sure what could possibly happen if this child applied the lotion. Sure, nothing could happen. It might just be regular lotion, but we don't know that. Additionally, does the RBT have the right to recommend things like healthcare products such as lotion? Did the RBT do anything wrong? That's what the question wants to know. A, no, this was within the scope of the RBT's competence. Unless the RBT is some sort of qualified skincare professional or healthcare professional, it is not within their competence to recommend even lotion to the client. Okay. Anything could occur if something would happen with that lotion in the client's skin. And then who is responsible? The BCBA. RBT should not be giving this advice. B, no, the RBT is building rapport with the mom. Nothing wrong with the RBT building rapport. That is great. That's perfectly acceptable. Recommending things like lotion, however, is unacceptable. C, yes, the RBT should not be engaging in small talk with the parent. Again, incorrect. Totally fine to be engaging in the small talk. There's nothing wrong with that, right? Rapport building is fantastic. However, D, yes, the RBT should not be giving out advice related to the client is the right answer. Unless you, the RBT, have been cleared by a supervisor or you've talked it over with your supervisor, you should not be giving advice about treatment, about health, about anything, okay? It's too risky, right? You're not qualified. You are putting the whole team at risk. You're putting the client at risk, okay? You mean well. Clarissa means well, right? But what if there's something that goes wrong with that lotion? Okay, now it comes back on everybody. What do we do in this situation? We say either we just politely don't mention anything, right? Or say, I will talk to my BCBA supervisor and we will try to figure something out for the dry skin. However, the RBT should not be giving this advice. The answer is D. Did the RBT do anything wrong? Yes, the RBT should not be giving out advice related to the client. You and your roommates are sitting on the couch around dinner time. You decide to order some food for delivery. You open the app, place your order, and wait. 45 minutes later, a delivery person drops off your food at the door. The delivery person dropping off food will be considered what? Okay. This is a reinforcement question, right? Actually, it's an automatic versus socially mediated reinforcement question. What is automatic reinforcement? Automatic means alone, okay? Automatic reinforcement means you're delivering reinforcement yourself or the client is delivering reinforcement yourself. When we talk about sensory behavior, we mean automatic reinforcement. Socially mediated reinforcement means reinforcement is delivered from another person, right? There's a second or third party involved. In this case, when you order food from an app and wait, and then 45 minutes later, a delivery person gives you food at the door, reinforcing your behavior, well, is that automatic or socially mediated? Well, it's obviously socially mediated, right? Automatic, again, means alone. You need that delivery person to deliver that reinforcement to you. The delivery person dropping off food would be socially mediated reinforcement. Now, is that positive or negative? Well, we're adding the food, right? We're adding, the delivery driver is giving you your food, okay? It's going to be positive reinforcement. So altogether, we have socially mediated because it's a second person, positive adding reinforcement because in the future, if you want food, you're going to continue ordering from this app. The delivery person dropping the food off would be considered socially mediated positive reinforcement. Jessie is a graduate assistant at Louisiana State University. Jessie's supervisor asked her to record the percentage of students who come to class on the first day. On the first day, 20 out of 27 students come to class. What was the percentage? All right, just a basic percentage question to just work on our fluency with percentages. So how do we find a percentage? Well, we take the little number and divide it by the big number. Simple as that. So if we have 20 out of 27, we have a ratio. How are we going to find a percentage? We'll take 20 divided by 27, and you're going to get what? 74%. What's the percentage? 74% of students came to class. Simple as that, okay? Well, you need to know how to find an average. You need to know how to find a percentage. If you don't know, you need to practice. Don't miss these easy questions, okay? Percentages, averages, totals are so easy. Make sure you understand how to do them. Eduardo and his family buy a bunch of fireworks for the 4th of July. At midnight on the 4th of July, they start to light the fireworks, and the fireworks start to explode. When the fireworks start to explode, the dogs start barking, and the neighbors come outside and ask the family to keep it down. What is the SD for the neighbors coming outside? When determining SDs, what are we looking for? Well, we know SDs are antecedents, so they're occurring right before the response of interest. In this case, our response of interest is the neighbors coming outside. So what we need to identify is what led to the neighbors coming outside, right? What was the cue, or not the cue, but the instruction or the SD or the antecedent to the neighbors coming outside. So midnight, the fireworks exploding, the dogs barking, or it is the 4th of July. Well, it's 4th of July all day, and the neighbors only came outside at the end of the night. So we can eliminate it's the 4th of July. What about midnight? Well, midnight occurs at the beginning of the scenario before all the fireworks start going off. The neighbors don't come out until after the fireworks have been set off. So we can eliminate midnight. The fireworks exploding don't cause the neighbors to come outside. What the fireworks exploding cause is the dogs to start barking, and the dogs barking results in what? The neighbors coming outside. So the SD for the neighbors coming outside, or the antecedent, is going to be the dogs barking. Okay, thanks for watching. Please like and subscribe. Check out rbtexamreview.com for all of our study materials. Any questions, comments, let me know. Work hard, study hard. See you soon.